Hi, everyone. I am Dr. Kristen, one of the good doctors of Abbey Research. And we at Abbey Research, Research, do you love how sometimes I can't speak? Guys, super professional over here. We at Abbey Research are big believers that everybody can get along just a little bit better than we already do. And our whole lives are geared towards that purpose. And the first step in doing that is understanding everyone else's worldview a little bit better than we already do. And in service of that, we have this series where I get the privilege of talking to utterly fascinating folks who are different than me, which is everybody, about something that they are an expert in or passionate about so that we can learn a little bit more about their world. And today I am joined by Dr. Sonia Chopra, who is one of the most interesting, fascinating folks I've met in a minute. So I'm so excited she's here. All good dental practitioners know that every tooth has a story, but it's only the great ones that recognize that it's people's stories that really matter. Have you ever thought about your teeth and your personal story? I have not until this moment. Because understanding where your peers and patients are in their journey is the key to building strong relationships and a stronger practice. And it's all rooted in self-empowerment. Guys, oh my gosh. Dr. Sonia Chopra knows a thing or two about this. You don't become the first female endodontist in Charlotte, North Carolina, and board certified to boot without a serious growth mindset and a strong dose of hustle. Her entire career has been characterized by pushing herself and empowering others to grow as entrepreneurs, leaders, and patient advocates, all in the service of creating a more educated, balanced field. Because Sonia refuses to mind the dentistry status quo. When no one would hire her out of residency, she started her own practice. When she felt she was losing time with her family due to how many hours she was spending in the office, she became more intentional with her schedule. And when she realized she could save more teeth, and improve people's lives by providing dentists with proper education, she took it upon herself to lead the charge. Don't worry, I'm going to ask her about all that. Now, on top of her thriving practice, Sonia provides groundbreaking digital education and community support to dental dentists and endodontists who want to up-level their technical skills, patient experience, and overall business models. Through her thoughtfully designed online course, eSchool, she is revolutionizing the reputation of endodontics through the simple, tangible lessons rooted, that is a fantastic pun, in her own diverse experience by empowering dentists to perform better root canals, empowering endodontists to run better practices, and empowering patients to make better health decisions. Sonia is paving a new way forward for the next generation of healthy, confident, empowered people, both in and out of the chair. Dr. Sonia, thank you so much for joining us.
Thank you so much for having me. It's
this is so much
fun.
Exciting.
I love it.
I was sharing with Dr. Sonia, folks who are watching, that I have some of the world's worst teeth. And so I am always both slightly terrified and slightly excited to talk to dentists, because I was like, I have paid for so many of your vacations. But I first got a chance to hear and encounter Dr. Sonia's idea through our mutual friend, Trisha Brooke, who you've heard about a lot on this channel and is a past guest of Welcome to My World. And the very first time she told me about it, she said, you know, when I have a client and friend who wants to save more people's teeth. And I was like, tell me more. Tell me more. So, Dr. Sonia, tell me more. Why is saving teeth such a kind of essential part of connecting to personhood? Like, how is that? How do you see that working?
Well, we weren't born with teeth. Like, there's a reason why we were born with teeth, right? Like, we shouldn't just take them out. So for me, it's a really personal story because I had my own tooth story. I had a toothache when I was younger, when I graduated high school, and nobody could tell me where the pain was coming from. They kind of played eeny, meeny, miny, moe, and then pulled out a tooth, and it was the wrong tooth. And I was born without 8 permanent teeth. So
you didn't have an abundance to go around.
I didn't. So, right. So this situation made it the 9th. And for me, my value of teeth going through that, you know, not being able to function, you know, it really had an effect on my body. And our mouth is the gateway to our body. And our teeth are what bring in our nourishment and our hydration and allow us to lead a long and healthy life. And since everybody has teeth, and most of us have 32, except for me, that means we all have 32 chances to need a root canal or be put in a situation where we may need to save our teeth. And that's pretty good chances. So that's kind of my mission. I really want people to be better advocates for themselves, their bodies, their oral health. Because a lot of times when you need a root canal and you have a toothache, it's the worst time. It's a Friday, it's a Saturday, it's a Sunday, when nobody's open and you really don't know what to do. And there's just a better way to live. There's a need for this education for patients as a whole, just to be able to navigate their way through the dentist. I think it's really important.
I totally agree. Especially, I think your particular specialty is a little bit mystifying to those of us who aren't a part of it. And whereas I certainly feel a lot more empowered to push back on some of my doctors about my body. Like, well, I know my knee doesn't work like that normally, or I know my stomach handles things differently. I feel really mystified about my teeth. I just know that when it hurts, I need it to stop immediately. And
Correct.
so I'm sure I'm not alone. And then that's one of the reasons that a lot of us don't feel comfortable asking questions of our dentists or advocating for ourselves. So in terms of, I got a toothache, I really need to go in, and my dentist says they need to pull the tooth. What should I be asking instead?
Why? Number one is why. Why does this tooth need to come out? Because what I've learned over time is that some teeth are taken out that really could be saved. So I'm even working on the belief side of dentists. Like, what do you believe can be saved and what do you believe has to go? That's a really important piece. And, I'm an endodontist, I'm a tooth saver. There's very little awareness of my specialty, number one, with the majority of the world. They're like, oh, what are you, an endocrinologist? No, I'm an endodontist. And, just having an awareness about our specialty is probably step one, right?
Right. So what is an endodontist?
We are root canal specialists, AKA tooth savers. So once your tooth gets infected or diseased, we remove that infection or disease and save your tooth. Because there's nothing better than your own tooth.
Just that simple. So then afterwards, sometimes we might need a crown or we might need something else, but that is still fundamentally saving the tooth because the root of the tooth is still connected to our body.
Correct.
Okay.
Correct. Okay. And it's a piece of us. It's a piece of us.
And
it's easy. Sorry.
No, please go ahead. Please go ahead.
No, I was going to say, it's easy to hide behind these lips. And, some people are like, oh, well, you can't see it. You can take it out, but there's just so much that these teeth do for us. It really, sometimes I feel like our teeth are undervalued, and that's really what I want to bring to the spotlight.
Oh, I mean, I think they're very undervalued, because I know, so I had reconstructive jaw surgery when I was in high school, and they had to move my bottom jaw back and my top jaw forward to make sure that I could bite, actually chew my food. Because the way that my teeth were meeting before, I was just mashing them. I wasn't utilizing my teeth well. And the difference in how I was able to digest was completely different. How I was able to do after that surgery was so different. So I can absolutely attest that we don't really understand the power of our own teeth. We often take them for granted or complain about them more than really understand their power. But I want to bring up something that I heard you say in a talk that I attended of yours a little while ago, which is that the best thing to do for a tooth that has fallen out is not to put it in a baggie and go to the emergency room. It's to do something else. Can you talk about that?
Yeah. So let me paint the picture first, because this actually happens more often than you think. And again, at the worst time, it's a beautiful spring day. You're in your backyard. You're jumping on the trampoline. Trampolines seem to be the number one environment.
A part of this. It's like trampoline and T-ball, probably. Yeah.
Yeah. So, and you're jumping and you're having a good time. Everything's normal. And then all of a sudden, one of you lands wrong, and your child takes your knee to their face, right? And their front tooth gets knocked out. So I want to make it clear, this is an accident. It's not you didn't take care of your teeth and then it fell out. This is, oh, whoops. This is, whoops, I hit the pavement wrong, or the baseball hit me in the face, or I jumped on the trampoline and now we're in this situation.
Right.
Most people feel first they panic, right? Then they go look for the tooth, and then they put it in a bag and go to the emergency room. That's a problem, because that's really not what you should do. Okay. Other people have been taught to put it in milk, which will buy you some time. But all of the scientific research shows that if you can get your tooth back into the socket within 30 minutes, 60 minutes is pushing it, but between 30 and 60 minutes, you have the best prognosis of saving that tooth, whether it's your tooth, your child's tooth, or maybe if it's a play date happening at your house, or if your child is at another house. Every parent, school nurse, everybody should know this, but they don't. You should pick up the tooth and put it right back in the socket. Sometimes the tricky part is making sure it's facing the right way. You don't put it in backwards. But most people panic because there's a little bit of blood, there's a little bit of pain, and they really have just never been told what to do. But the simplest thing and the best thing to do is get that tooth back in. There's these little cells that attach your tooth to your bone, and that's what keeps your teeth in. And those cells will die if they dry out within 30 to 60 minutes. And you want to preserve those cells. So if you want to get it back in, you don't want to rinse this tooth off with water. You don't want to scrape off the junk. You want to delicately handle the tooth, get it back in, and then guess what? Go to a dentist, because emergency room personnel, they really don't know how to handle something like this. Now, if it's a major accident where you broke bones or something in the face, that's a different story.
Right.
But if it's just the tooth that came out, head to your dentist, or better yet, head to an endodontist, because we handle this stuff all the time. But that will probably save your tooth as if it never flew out in the first place.
That's a great point about washing it, because that would have been my first instinct, would be to rinse it off, because I would think it got dirty, it went somewhere, I need to make sure I disinfect it in some way before I put it back in the kit. And you're saying no.
Not with water.
Not with water. Okay, so what should I know to clean it with if it needs cleaned?
So I would probably take a bowl of milk or a cup of milk and just dunk it.
Okay.
But you have the tooth, the crown, and you have the root. So the side that you smile with, like that you see the white part of the tooth, that's the side that you want to grab the tooth with.
Okay.
You do not want to touch the root. So you want to just grab the tooth by the crown, which is the white part that we see when we smile, and you can just dunk it in the milk and then stick it back in. Now, you can get your tetanus shot later. That's fine, but which you should. But if you're worried about ew, that's gross, it just fell in a pile of mud, that's okay. The tetanus shot will fix that. You want to get this tooth back in as quickly as possible. And if you go to the emergency room, sometimes you're waiting in the waiting room for 6 hours before they even see you.
And at that point, the tooth is dead, and there's no,
you have a way less chance of saving that tooth. And that's your front tooth. That's where you build your smile and your confidence. And especially if it happens at such a young age, you can't even get a new tooth there because you have to go through all that growth and development. So, I mean, there are so many people that this one little, I don't want to call it a hack, but a hack,
it kind of is.
It kind of is. Yeah. You want to just get that tooth in right away. And then your dentist will splint it and get it back to normal. And then guess what? It'll just tighten back up, believe it or not, because this is what our bodies as humans do.
Because we're like regenerative properties. Like we know how to heal ourselves from more things than we give it credit for.
Absolutely. Absolutely.
Fascinating. So this has obviously been beyond just your own tooth origin story. And then when you went into dental school, what was that always going to be, okay, so now I'm always going to be an endodontist, or was there, another piece of the journey somewhere in this?
So I knew, I didn't know. I was told that I had to be some form of doctor. I'm Indian American, so my parents were like, you got 4 choices. That's it. Doctor, dentist, lawyer, engineer, or we're not going to be pleased. So my mom and my brother are both physicians.
Okay.
And I saw their lifestyle, and I did not love their lifestyle. And I was hurt when my mom wouldn't be able to come to my dance recital. So I knew that wasn't what I wanted to give to my children. So I was very cognizant of that at a very early age. I knew that as a mother, when I became a mother, I was going to have different responsibilities. So I picked dentistry because I could be my own boss. and I could make my own hours, and I could, you know, have a little bit more control of my life than my mother did.
Okay.
So that was the driver. And plus, I was just always in the dental chair. So I knew what it was like to be a patient. So I married the two and picked dentistry. I wanted to give all of dentistry a shot because there's so many options of what type of dentist you could be. But that my own tooth story really, like, I could never forget it. And so throughout dental school, it just kept on coming up over and over. And I was very curious as to why I had the experience that I did. And I think that was really what pushed me into my specific specialty. And then I started my own practice. Again, not out of choice. I couldn't find a job when I graduated. And so I was kind of forced to, start my own. Yeah. People looked at me and they didn't really take me seriously. I looked little, and, that was
there's
my
the whole
journey.
lady business of it all, where like,
yeah. What is this little girl going to do for my practice? I wasn't an attractive candidate at the time. So I had really no choice. I either could be unemployed or start my own business. And so that's what I did. And no regrets.
Amazing. And did you start in general dentistry and then go into endodontics in terms of the practice? Okay.
Yeah. So I was a general dentist for a few years. And again, just realized endo was calling my name. And then now, as an endodontist, I have seen my story, or even these other stories where people knock out their front tooth and they had no idea what the proper protocol is. And so I see the void that, not just dentists, but patients, there's such a void for both types of people. And now that's the void I'm trying to fill.
I love it. And tell me a little bit about how, I know I read it in the bio, but in your your passionate words, you're such a strong communicator. Tell me how you're trying to fill that void right now and kind of what it looks like in your day-to-day life.
For me, it's education. I see that there's a lack in education, and it's nobody's trying to be, it's not like a malicious thing. It's just, there's a lot to learn in dentistry, right? So we get like a 2-week crash course in endo and dental school, and our requirements to graduate are 2, 3, 4, maybe 5 root canals, and that's it. And then we're allowed to do it, and it's a very technique sensitive procedure.
As somebody on the receiving end from several physicians, you can tell when someone knows what they're doing and when they don't. Yeah.
And sometimes even the clinician thinks that they know what they're doing, but they don't, And again, I always say, we're just trying to do the best that we can with the knowledge that we were given, and, what we know. And it just doesn't translate properly, and 50% of what I do in my practice is fixing root canals. And so root canals have been given this horrible reputation because of that. And people need to understand it's really technique sensitive. So how can we make better, decisions, even as patients? Most patients really love and trust their dentist, and they want to stick with them. They don't want to find another provider. And that's why a lot of people don't come see us as endodontists and specialists, because that's another appointment, another person to get to know. And now I have to retrust somebody else. And that can be a big decision for a lot of people. But
that's fair. I wouldn't have gone to an endodontist. My current dentist, who is somebody I deeply trust the whole practice, when I needed a root canal with them, they referred me directly to an endodontist and said, this is who we trust, this is who we use, and we've made the appointment for you. And if they hadn't done any of that, I would have absolutely just been like, I'll just find another, are you sure you can't just do it here? And they were really, really clear about what a specialty it was.
Right.
And I was in my mid-30s, and I had already had 8 to 10 root canals that a dentist did.
Yeah.
And had no idea what a specialty it was until this particular provider.
Yeah. Because that person understood their boundaries. They knew that, they have their own specialty in their practice. They do the things that they know that they're good at, but they get that somebody else could probably do this particular procedure better. Some general dentists are great at root canals, but a lot of them don't feel comfortable doing it. And they almost feel like a disappointment to their patients when they can't offer that service, but they shouldn't. They should feel proud that they understand that boundary of theirs and that they can refer. And so most people need to be aware that, not every dentist is going to be a one-stop shop.
Yeah.
And dentistry is so vast, just like medicine. That's why you have brain surgeons, you have OBGYNs, you have dermatologists, because every organ has its own specialist. But the same thing should be made of dentistry, but it's just not that way. And that's why I think sometimes people say they don't like the dentist, because I think if it was structured differently, we would have a different experience going to the dentist. And that's why some people find it really expensive, because they have to do their work twice. That's why 50% of what I do is redoing root canals that were already done. And I don't want that for anybody. I want people to treat a tooth, and that should be it. Like, it should be one and done. They shouldn't have to come see me. And by the time people get to me, they've spent like $5,000 on one tooth. So,
yeah. In 1 year, I spent 3 times my mortgage on my teeth.
Yes.
Yeah.
So that's my BHAG. My big, hairy, audacious goal is, how do I help decrease global healthcare costs for everybody? And this is my solution, through education.
I love it. And your piece of just making sure we only have to pay for it once instead of like 4 times, which is deeply, deeply helpful. Yeah. I have a million more questions, but this is a great place to hit pause. So if you are watching this and you are obviously a dental student or an endodontist, there's lots and lots of resources that are going to be underneath here. But if you're just like me and really curious about how the world works and potentially have teeth that require quite a lot of external maintenance, Dr. Sonia's, all of her social media links and websites and everything are in the show notes of wherever you are listening or watching this. And make sure to stay in touch and watch what she's going on. I know I can't wait to see, kind of, as you continue to do this education and continue to be loud about it. I'm excited for other people's minds to be blown about not putting your tooth in a Ziploc bag, because that's just so delightful. If you've liked this video, then please make sure to give it a thumbs up. It does really, really help if you're joining us on YouTube. If you like our content and you like to hear other conversations with fascinating folks, potentially about empathy, inclusivity, and equity, that is all we do here at Abbey Research. So make sure to subscribe to the channel and hit the bell so you don't miss any content. We also have a channel called Abbey Research Reads, where we do book reviews on books about inclusivity and equity and all the like, and we would love to have you join us over there as well. In the meantime, Dr. Sonia, thank you so much for joining me.
Thanks again for having me.
It's been an absolute delight. I am such a geek, but I had so much fun. I hope you guys did too. And we'll see you next time on Welcome to My World. Bye.